Question 1. A 2-year-old child presents with a high fever, cough, and labored breathing. On examination, you hear wheezing and crackles on lung auscultation. What is the most likely diagnosis? A. Bronchiolitis. B. Asthma. C. Pneumonia. D. Croup. Answer 1. C. Pneumonia. Explanation. Pneumonia in a young child can present with fever, cough, and respiratory distress. Crackles and wheezing on lung auscultation are common findings. Question 2. A 6-month-old infant has not yet started to roll over, grasp objects, or make babbling sounds. What is the most appropriate next step in management? A. Begin speech therapy. B. Wait for further development. C. Refer to a neurologist. D. Start physical therapy. Answer 2. B. Wait for further development. Explanation. Developmental milestones can vary among infants, and some may achieve these skills later than others. It's important to monitor for further development before considering intervention. Question 3. A 4-year-old child presents with a sore throat and a fever. On examination, you notice exudative tonsillitis and tender cervical lymphadenopathy. What is the most likely causative organism? A. Streptococcus pneumoniae. B. Haemophilus influenzae. C. Epstein-Barr virus, EBV. D. Streptococcus pyogenes, Group A Streptococcus. Answer 3. D. Streptococcus pyogenes, Group A Streptococcus. Explanation. Streptococcus pyogenes is a common cause of exudative tonsillitis and tender cervical lymphadenopathy in children. Question 4. A 10-year-old boy presents with frequent abdominal pain, diarrhea, and weight loss. His symptoms are relieved after defecation. What is the most likely diagnosis? A. Celiac disease. B. Irritable bowel syndrome, IBS. C. Crohn's disease. D. Appendicitis. Answer 4. B. Irritable bowel syndrome, IBS. Explanation. Irritable bowel syndrome, IBS, is characterized by recurrent abdominal pain that is often relieved after defecation. It can present with diarrhea, constipation, or a mixed pattern. Question 5. A 7-year-old girl presents with a sudden, severe headache and vomiting. On examination, there are signs of increased intracranial pressure. What is the most likely diagnosis? A. Migraine. B. Tension headache. C. Brain tumor. D. Sinusitis. Answer 5. C. Brain tumor. Explanation. Sudden, severe headaches accompanied by vomiting and signs of increased intracranial pressure, such as altered consciousness or papilledema, should raise suspicion of a brain tumor. Question 6. A 2-month-old infant has a persistent yellowish discoloration of the skin and sclerae. Laboratory tests show elevated serum bilirubin levels. What is the most appropriate initial treatment? A. Phototherapy. B. Blood transfusion. C. Intravenous antibiotics. D. Surgical intervention. Answer 6. A. Phototherapy. Explanation. Phototherapy is the initial treatment for neonatal jaundice, hyperbilirubinemia, to help reduce elevated bilirubin levels and prevent kernicterus. Question 7. A 3-year-old child presents with a rash that started on the face and has spread to the trunk and extremities. The rash appears as pink, raised lesions with a sandpaper-like texture. What is the most likely diagnosis? A. Measles, rubeola. B. Rubella. C. Scarlet fever. D. Chickenpox, varicella. Answer 7. C. Scarlet fever. Explanation. Scarlet fever is characterized by a rash that starts on the face and spreads to the trunk and extremities. The rash has a sandpaper-like texture and is often associated with streptococcal pharyngitis. Question 8. A 5-year-old boy presents with difficulty breathing, wheezing, and coughing, especially at night. What is the most appropriate first-line medication for managing his symptoms? A. Antibiotics. B. Antipyretics. C. Inhaled corticosteroids. D. Bronchodilators, e.g., albuterol. Answer 8. D. Bronchodilators, e.g., albuterol. Explanation. Bronchodilators, such as albuterol, are the first-line medications for relieving the symptoms of asthma in children, including wheezing and difficulty breathing. Question 9. A 6-month-old infant presents with vomiting, diarrhea, and sunken fontanelles. Physical examination reveals poor skin turgor. What is the most likely diagnosis? A. Gastroenteritis. B. Dehydration. C. Food allergy. D. Intussusception. Answer 9. B. Dehydration. Explanation. The symptoms and physical findings described are indicative of dehydration, which can result from conditions like gastroenteritis with fluid loss. Question 10. A 9-year-old girl presents with joint pain, fever, and a faint rash on her cheeks. She mentions recent throat and ear infections. What is the most likely diagnosis? A. Juvenile idiopathic arthritis, JA. B. Systemic lupus erythematosus, SLE. C. Rheumatic fever. D. Kawasaki disease. Answer 10. C. Rheumatic fever. Explanation. Rheumatic fever can develop following streptococcal infections and can present with joint pain, fever, and a rash, among other symptoms.